Basically, you're on an island with 100 players, and the goal is to be the last one standing.
Like many 12-year-old boys, Matthew Blaine loves gaming.
So now I'm just going down here and I'm trying to get guns.
In fact, many of the Nazareth preteen's interests and behaviors are typical for a kid his age.
I like video games, soccer, hockey. I like watching TV. I like building forts. I like just going in my room and playing around with my Legos.
Very smart, very funny, silly. He just wants people to laugh all the time. He's very trusting, he's very honest. This was right before he first got his glasses.
But a few years ago, Matthew's mom, Nicole, noticed her oldest son acting not so typical for his age.
Everything started at around 5. We started noticing some things like the infections and little things like he wasn't listening that well, so it wasn't really a big deal until he reached 4th grade. That's when I was getting phone calls from the school all the time for behaviors, and the separation anxiety was really bad.
I just get really mad sometimes, and it's hard to remember things a lot of the times, and I don't like it at all.
Matthew, what do you want for dinner, honey?
Chicken nuggets.
What do you want with it?
French fries.
French fries and chicken nuggets. I don't know what's in his control and what's out of his control. When he's not listening and stuff, sometimes he has no memory of what happens. He'll be crying, and there were times where he was spitting and just acting out of control, but he doesn't remember sometimes after it.
The mom of 3 knew something was off, so she set out to get some answers.
I got this one for Christmas.
He was diagnosed with ADHD, ODD, anxiety, social pragmatic communication disorder, and a tic disorder. He was on 4 or 5 different medications for that stuff, and nothing helped.
The behaviors persisted, but so did Nicole. She scoured the internet and found information about 2 neuropsychiatric disorders referred to as PANS and PANDAS.
And I read all of the symptoms, and I was like, well, this fits. So I had to go to the pediatrician and tell him that I wanted all the blood work. He argued with me about it, but he did eventually order it.
Matthew's blood work came back high for strep.
He would always get strep skin infections. He never actually got the strep throat. He would always get raw open infections on his skin.
It's like a rash, but I don't really feel it at all.
The family was finally getting some answers. A specialist Nicole found in Long Island diagnosed Matthew with PANDAS, then referred him to a doctor closer to the Lehigh Valley.
PANS, P-A-N-S, stands for Pediatric Acute Onset Neuropsychiatric Syndrome, and that can be caused by both viruses and bacteria. Some of the more common ones are mycoplasma, which is the germ that causes walking pneumonia, the flu, COVID, and strep. When the condition is triggered by strep, it's called PANDAS. So PANDAS is actually a subset of PANS. And PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorder Associated with Streptococcal Infection.
Dr. Angela Camasto is Matthew's pediatrician from the Woodlands Healing Research Center.
I focus on complex chronic medical problems like autism, PANS and PANDAS, ADHD, Lyme, Bartonella, tick-borne illnesses, that sort of thing.
The mission of the Quakertown nonprofit is to treat people with chronic medical illness, in addition to providing primary care for all ages.
We are similar to conventional medicine in that we do take insurance, but we are different in that we are looking for root causes of illness and using some integrative and holistic methods to try to heal the person's body.
Camasto says PANS and PANDAS are 2 types of inflammatory brain conditions that occur when an immune response gets misdirected. So instead of targeting the infection, it causes inflammation in the brain, which causes psychiatric conditions.
A typical PANS or PANDAS case will present with an abrupt onset of OCD or eating restriction, usually at the same time as an illness or shortly after, maybe even up to 1 to 2 months after. Some of the OCD behaviors to be aware of are excessive hand washing, sometimes an overwhelming sense of guilt and needing to confess even the smallest mistakes, compulsions to go through routines and rituals for simple activities of daily living. Sometimes the child may need constant reassurance, which would present with repeated questions over and over again, like, is the door locked? Is the meat cooked? That sort of thing.
The pediatrician says there are 3 criteria she uses to diagnose the conditions.
So the first criteria is, again, the abrupt onset of OCD or eating restriction. The second criteria, you have to have 2 other neuropsychiatric symptoms from a list of 7.
Those criteria can be found on websites like the Neuroimmune Foundation and the PANS and PANDAS Network.
And then the third requirement is that you're making sure that you rule out any other kind of medical or neurologic condition. So in a sense, this diagnosis is a diagnosis of exclusion. You always want to be considering other more severe or appropriate diagnoses for the situation.
This one I just got last weekend, and I built it together in 5 minutes.
In Matthew's case, he was able to receive a diagnosis in 2023 and has been undergoing treatment ever since.
Once we knew that it was PANDAS and he started getting treated for that, then they started going away.
I have found that patients respond best when we use a 3-pronged approach to treating PANS and PANDAS. The first approach is to take a very thorough history and do very comprehensive lab work to try to find the triggering infection. And once we find it, we treat it with appropriate antivirals or antibiotics. The second part is to try to decrease the immune response's inflammatory cascade. And we can do that with medications like NSAIDs, like ibuprofen or steroids. And I also use, being an integrative office, I use herbs and supplements like fish oil and curcumin. And then the third part is to treat the psychiatric symptoms. So we often encourage getting involved with therapy that's targeted specifically for OCD. And in some cases, psychiatric medicines like SSRIs are needed.
Saturday's gonna be 79 degrees. So what do you want to do?
Soccer in
We
the
could play
backyard.
soccer outside. He was started off on 2 antibiotics and he's on like a ton of supplements. He doesn't have the separation anxiety anymore. That was a big thing that completely disappeared. The rage, like he used to get really angry and like throw things, like that part has disappeared. Like that went away.
As symptoms disappear, the Blaine family says they are able to get back to a more normal life.
Field day is coming up, and the carnival, and the field trips.
I think it is very possible to get kids into remission for this. It is a lot of work and time.
I feel like I've been getting a lot better since I saw my first doctors, and I feel a lot better than I used to.